The COVID-19 pandemic continues to wreak havoc on our community. Currently, we continue to learn more about COVID-19, but there remain many questions and misconceptions about this pandemic. Over the next hour, we will talk with medical experts and officials about what we can expect as our nation and community moves forward. Here is 5th District United States Congressman Ralph Norman.
Good morning. I want to thank everybody for taking the time to join us today, whether it's on radio, TV, or Facebook. We appreciate it. My job as a congressman is to keep you informed on events as they come to us, and none is greater than the coronavirus. This is the fourth in a series that we have done this. The first one was on the payroll protection plan. The second was on unemployment insurance. The third was on the PPP. And now we want to cover what's new in the virus and how we're handling it. The questions that you will hear for the next hour are ones that we have gotten either from email, Facebook, or call-ins. So I think you will find it very interesting, the questions that we'll be addressing. And we've got a great group that's going to address them as professionals. I want to introduce Dr. Raj Prasina. He is a board-certified infectious diseases and internal medicine, practices in Rock Hill with infectious disease specialist of the Piedmont. We have Dr. Michael Ketchka. He is an epidemiologist and medical consultant with South Carolina's DHEC. And we have Dr. Anand Shah. He is the Deputy Commissioner for the Medical and Scientific Affairs at the U.S. Drug Administration. And his family, Dr. Shaw, is a cardiologist, has been here for a long time in our community. And then we finally have Kathy Rose Hicklin, who handles everything in my office that concerns details. And let me say, you can follow me on Facebook, Twitter, and Instagram at Rep. Ralph Norman. Be sure to visit my website and sign up for the emails, updates at norman.house.gov. And I want to thank the radio stations for carrying this today. WRHI in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Comporium Cable in York and Lancaster counties, which is covering this. There will be a replay of this. It'll be posted later on this afternoon at norman.house.gov and my Facebook page at facebook.com/Rep. Ralph Norman. Just a quick update. Yesterday, I was in Washington. We voted on $430 billion more basically for the small businesses, the PPP program. I think that will be funded probably midday Monday, and I urge those who had applications in to start Monday, if not sooner, going and rehashing with your banker where you stand with your application. If you have any problems, Kathy Rose would be happy to help you, and so to give us a call. Let's dive right into the program. I want to ask the questions. Start off with Dr. Prasina. What do we know now about the COVID-19 that we didn't know earlier?
Thank you, Congressman. It's been quite an adventure. We have been basically wading in uncharted territories for a long time now. But every day we learn something new as far as this terrible disease is concerned. We now know that this is not just a respiratory tract infection. We do see a lot of complications involving the central nervous system, heart, kidneys, liver. It's a multi-organ disease, gastrointestinal tract. And so we are paying a lot closer attention to those systems in anybody who has a severe infection with this. And we are also learning about what really works and what doesn't work in these patients. We are saving a lot of lives, a lot of patients that early on we thought would have died. Now we have developed different approaches and different protocols that we are using to save their lives. And so I expect that in the next few weeks, we are going to see a lot more exciting news. There's a lot of research being done. and a lot of them, the preliminary reports are very, very exciting.
Moving pretty fast, aren't they?
Very, very fast. This is the fastest I have ever seen research and development ever in the history of medicine.
Great. Dr. Shaw, let me go ahead and get your opening statement. I know from the FDA you wanted to say a few words.
Thank you, Representative Norman, for inviting the FDA to join today. It's great to join the 5th District of South Carolina this morning. I really appreciate the opportunity to provide an update on the critical role that FDA is playing to combat the COVID-19 pandemic. Thought we'd just take a few minutes to briefly highlight a few areas of work going on right now at the FDA with regard to treatments and therapies, vaccine development for COVID-19. At this time, there are no FDA-approved drug products to treat COVID-19. Since the beginning of this pandemic, we've been working to facilitate the development and availability of therapeutics for the use by patients, physicians, and health systems as expeditiously and safely as possible. What's most notable recently is that on March 31st, the FDA stood up a new program to expedite the development of new treatments. We call this the Coronavirus Treatment Accelerator Program, or CTAP. We're using every tool at the agency's disposal to bring new therapies to sick patients as quickly as possible, while at the same time supporting research to further evaluate whether these medical countermeasures are safe and effective for treating patients infected with this novel virus. We're maximizing our regulatory flexibility, cutting the red tape, providing ultra-rapid advice and review. We've streamlined our internal processes and operations for treatment developers and scientists to send in inquiries and requests to us as an agency. We're providing resources to healthcare providers and researchers proactively to help them submit emergency requests to use investigational drugs. For example, we're reviewing study protocols within 24 hours in many cases. And when we receive requests for single patient expanded access requests, we're generally able to review those within a matter of a few hours. We're looking at a number of therapeutic areas, so antiviral drugs that might treat the specific virus. We're looking at drugs that inhibit certain receptors and may be helpful in reducing lung inflammation and improving lung and breathing function in patients with COVID-19. We're looking at therapies such as convalescent plasma and hyperimmune globulin. These are blood products that are taken from blood donated by people who've recovered from the virus. That could shorten the length or lessen the severity of the illness, and I'm happy to talk about convalescent plasma a little bit later this morning. And on April 7th, we issued some guidance to provide recommendations on pathways available to doctors for the use of investigational convalescent plasma. We're also working very hard to evaluate whether other existing therapies that many of you have heard about on the news, such as chloroquine and hydroxychloroquine, treat patients with COVID-19. Really, our agency's public health work requires striking the right balance between aggressively supporting innovation and ensuring that Americans can continue to trust the drugs that they take. We're working with all sectors of the United States and the world to expedite the development of a new treatment. Just a few words about a vaccine. At this time, there is no vaccine to prevent COVID-19. We're working with a whole host of companies, developers, academics, other researchers to help expedite a vaccine and bring that to market. On March 18th, the agency, FDA, we worked with our European counterpart, the European Medicines Agency, or EMA. We jointly chaired a global regulators meeting to discuss how we can synergize and work together to develop a new vaccine. We had more than 60 experts representing 25 agencies, 17 countries in that meeting, including the World Health Organization. And on March 30th, the Department of Health and Human Services, or HHS, we took steps to speed the development and manufacturing of a vaccine. We're working with New Jersey-based Janssen Research and Development, Moderna of Cambridge, Massachusetts, and notably, the Janssen Phase 1, or early-stage clinical trial, is set to begin no later than the fall of 2020, with the goal of making a vaccine available for emergency use in early 2021. So we're working across all of our federal partners, looking for, ability, just opportunities to work together find that right vaccine and be able to rapidly scale up and bring that to market. And we're intending to use all the flexibilities given to us by Congress to make sure that we have the most efficient and timely development of a vaccine for COVID-19. So with that, I'll pause. I want to thank again Congressman Norman and my fellow panelists, Dr. Persina and Dr. Katka. Thanks again to meet with all of you today by radio.
Great. That's my number. The questions I get the most often are, when's the vaccine going to be available and when could we expect it? Dr. Katka, what kind of results are we seeing from social distancing guidelines?
Thanks, Congressman. Yes, we're seeing some good results. We've not seen a decline in cases in the state yet. But we've kind of plateaued, which is actually good news because in the phase we're at, we would expect to see a lot more cases popping up. So the fact that we've seen this kind of flattening of the curve is encouraging, and we believe that the social distancing guidelines have been really effective at making that happen.
Well, it's encouraging when you go to the post office or the grocery store, people are keeping their distance. It's common sense, and I'm glad to hear you say that. Something that if we're aware of it, it makes a difference and people are doing it. Thank you. Dr. Persina, what underlying health issues are the most dangerous for those who have the COVID-19?
Yeah, so the majority of the patients that tend to have complications with COVID-19 tend to be above the age of 65 with certain underlying conditions, especially if those underlying conditions are uncontrolled. Conditions such as cardiovascular disease, hypertension, heart disease, congestive heart failure, conditions like COPD, asthma, and cancer patients, even cancer survivors. They tend to have a higher risk for complications, hospitalizations, ICU, respiratory failure, and respiratory distress. Most patients without any underlying condition who are younger, they do quite well.
Thank you. This is for any of the doctors, and we've heard some of this on the TV. Will summer temperatures reduce infection rates, and what do we know about heat and sunshine's effects on COVID-19?
Yeah, so from what we know, this is actually not just true for COVID. I believe it's true for most germs. UV light, we use it in medicine as a disinfectant in the hospitals and in the healthcare setting quite often. Many of our instruments are even sterilized with UV light. And I'm hoping, I'm expecting that obviously the COVID-19, there was some announcements done yesterday that they had done some studies that showed heat and humidity as well as UV light and sun basically destroying the virus. And I'm hoping that this is going to hold true, and this is going to be probably one of the reasons why in the summer we expect that the numbers to decline significantly.
Any of the other doctors want to comment?
I think that pretty well covers it. I do agree that we are hopeful that this summer we will see a decline in cases for those same reasons.
Okay. Again, this is for any of our doctors. What's the thinking of a possible second wave of COVID-19 cases later this year?
So,
as we mentioned, we hope that this summer we will see a decline in cases. As we do open things up, there is the potential that we will see cases start to increase again, especially this fall. The concerning thing about this fall is we'll have flu season going on as well, so the potential for infection with both of these viruses, which could be potentially more dangerous. So that's one of the big concerns about the peak of cases coming this fall.
Yeah, and if I may add, of course, we are all worried about a second wave, and most pandemics we have seen that happen. But the good news, and what is really encouraging for the medical community as well as I believe the whole world, is that, number one, in the fall, we are going to be far more prepared than we were in the first wave. When this virus first came around the corner, we were kind of, I want to say, taken by surprise. And we didn't expect it to be so contagious. We didn't expect it to have such devastating consequences among some of our older patients. But now we know so much. Like I said earlier, that there is such a tremendous amount of research and development and preparedness. And I think that, in addition to decrease in the number of cases this summer that we expect, and the fact that we continue to prepare ourselves and we continue to study and we continue to learn more, and I expect we are going to have better treatments and preventive methods by this fall. Even though we may have a second wave, I think we are going to be really well prepared for it.
Yep. Dr. Shaw or Dr. Ketchka?
This is Anand Shah from FDA. I agree with the comments that have been made in that, I think that the biggest confounder as we come into the fall is, the arrival of flu season again. And, I encourage folks to continue to monitor, recommendations from state and local authorities, with respect to precautions that they should be taking. That's the best way that we can all work together to, flatten that curve.
Okay, let me remind everybody, this is Congressman Ralph Norman. For the next, 45 minutes, we will be answering questions on COVID-19, the new developments, what we can expect. We've got three professionals plus our staff here to go over questions that have been asked the most to us over Facebook, over email, and over calls. Dr. Ketchka, for those infected with COVID-19, there appears to be evidence suggesting higher death rates for our African-American and possibly Latino communities. What's causing these disparities, and how, in your opinion, do we address this?
So, yes, this is a disparity that we're aware of. This is something that's been reported throughout the United States and something that we're seeing as well in South Carolina. I believe African Americans comprise about 27% of South Carolina's population, but they're 41% of our COVID-19 cases and 56% of our COVID-related deaths. So that's something that we have been trying to address. We've been working with local churches to help communicate prevention messages to reach these communities. The WIC services, the Women, Infant, Children Nutritional Services that we offer, we're trying to do 100% of those over the phone for some of these affected communities. And also partnering with environmental justice advocates to raise awareness. So this is definitely an issue. And I should say that probably the reason for the disparity is, as we mentioned earlier in the call, those with these kind of conditions, high blood pressure, heart, lung conditions, chronic diseases, tend to be more common in this community. So that's probably one of the reasons that we're seeing a little bit of this disparity. So we'll need to continue to make these changes as well as offering more testing.
Thank you. Dr. Persina, and I've heard this question a good bit. If you had COVID-19, are you immune going forward? And what percentage of people are being reinfected?
Yeah, that's a very good question, and I know that we are looking into this matter. We are not yet sure that the antibodies produced are 100% preventive or even curative. There are studies, as mentioned earlier by my colleagues at the FDA, there are studies that are actually looking at immunotherapies and looking at convalescent plasma treatment. The antibodies, my personal feelings is that it is going to provide some degree of protection. Now, whether that's going to be 100% after having had an infection in the past, that is yet to be seen.
Right. This question comes from Carol on Facebook. This is for Dr. Shah. Do we have any new information about the possible transmission of COVID-19 through the food supply? or on the surfaces of food packaging? And what's the latest guidance on that?
Thanks to Carol for that question. We continue to monitor the food supply very closely at the FDA. We work very closely also with the U.S. Department of Agriculture. We continue to monitor that food supply very closely. We know, and there are studies that demonstrate that the virus can live on surfaces such as countertops, stainless steel, for a amount of time, and that could include food packaging potentially. We're working together again with our federal partners, to put out recommendations there and keep the public informed. And I would encourage folks to stay tuned, to us at the FDA for additional communication.
Okay. Dr. Ketchka, can you give us the latest stats for South Carolina, the number of cases, the recoveries, the deaths, and what the mortality rate as a percentage of the population? And I guess the other question that goes with that is, how does that compare with the seasonal flu numbers?
Sure. So far we've had 4,917 people test positive for the disease in South Carolina. We've had a total of 150 deaths associated with the disease. As far as percent recovery, we did that as an estimate. We estimate about 67% of our cases have recovered from the disease. That's based on a calculation that we got from the World Health Organization, something that's been done in other states. So those who have moved outside of the contagious period and have recovered from the disease, we estimate it's about 67% of our cases.
Okay, thank you. Dr. Shaw, question. If I keep a bottle of hand sanitizer in my car, will the heat of the summer months make it less effective?
Congressman, it's a great question. We know that hand sanitizer, like any other substance that you would keep, it can be sensitive to fluctuations in temperature, whether that's extremely hot temperatures or extremely cold temperatures. We recommend that the public just look at the label on the hand sanitizer, and oftentimes there is a prescribed range of temperatures, that are there. So for folks that are putting hand sanitizer either in a glove compartment or laying around in an automobile on their seat, just take a look at that label and follow the recommendations there.
Okay. This question comes from Caroline via email for Dr. Persina. Understand masks are recommended for use while in public places. Are gloves also recommended?
That is a very, very good question, and it always gives me kind of chills when I see people in the grocery store or a lot of places actually wearing gloves. Masks, as everybody knows, have been recommended by the CDC and the rest of my colleagues. And the reason we recommend masks is that it's quite often to prevent you from passing on the infection to the next person. Masks are not great protective instruments or PPEs for individuals. It's mainly the main public health message for them is actually the reason for them is to prevent the spread of the disease. If you have we are now beginning to understand that more and more people have asymptomatic infections, and quite a lot of us may have had even exposure to it without knowing it and never developed a disease severe enough requiring medical attention. But by wearing a mask, I will protect you, Congressman, and I'll protect him, everybody else sitting over here at this table, just in case I'm shedding the virus. On the other hand, gloves are horrible surfaces. They gather germs on their surface, they gather the virus, and the virus survives on the surface of the plastic glove for a prolonged period of time. I believe it can be up to even 2 days. And so when you wear a glove and you're walking around the grocery store, touching everything with that glove, I have seen people actually eating with that glove later on. And yes, the virus does not get into your body through your hands. So by wearing the glove, you're not adding a layer of protection to the skin of your hands. You're just adding something that is going to collect the virus, and then later on when you touch your face with that very same gloved hand, you are definitely putting yourself at risk. So no, I do not recommend wearing gloves at all. And the best practice is really good hand hygiene. Wash your hands as often as possible. Carry a hand sanitizer that contains 70% alcohol, minimum 60%. And sanitize your hands as often as possible. Remind yourself that anytime you've touched something that somebody else has touched, to sanitize your hands. Minimize or completely eliminate touching your face. One of the advantages of the face mask that we encourage people to wear is not only to prevent spread of the disease, but also face mask acts as a deterrent for people from touching their face. When the face is covered, they tend to, obviously there's a barrier. They're not going to be touching their nose and mouth as much.
Thank you. This is for Dr. Shaw. The FDA and the Surgeon General have urged healthy individuals to donate blood. Can COVID-recovered individuals donate as well? And why is that so important?
Congressman, thanks for the question. So, first of all, we encourage everyone to donate blood, and the American Red Cross continues, to monitor the blood supply and encourage donations. Let me just take a moment and walk through convalescent plasma. So plasma is the liquid portion of your blood. It helps with clotting. It supports immunity. Plasma also contains antibodies that fight off infections, so that those who have recovered from this new coronavirus will have antibodies in their blood plasma that help protect them against future infections. Doctors call this convalescent plasma, and researchers hope that convalescent plasma can be given to people with severe COVID-19 to boost their ability to fight off the virus. It's currently not known if convalescent plasma will be an effective treatment against COVID-19. Since there are no known effective treatments yet, multiple options, as we mentioned, are under investigation by the scientific community. So some information suggests that convalescent plasma could help some coronavirus patients, especially those who are seriously ill. And since plasma transfusions are generally safe for most patients, at the FDA, we announced an initiative to investigate this as a treatment option. We're working closely with partners such as the American Red Cross to assist with plasma collections from carefully screened, recovered COVID-19 patients to help enable rapid access to treatment for those who are most seriously ill.
Okay, thank you. Okay, we're 30 minutes in. Let me again remind you, this is Congressman Ralph Norman. We're having an update on the COVID-19 virus. We've got three professionals who are answering the questions that were most often given to us. I want to thank WRHI in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Comporium Cable carrying this in York and Lancaster counties. Let me circle back to the flu versus the COVID-19. What are the infection rates and the severity when you compare the two? And ask any of the doctors to comment on this.
Yeah, so this is Dr. Katchka with DHEC. So the one thing I can say about the severity, that the current estimates are that about 85% of people who become infected will have mild to moderate disease. I should correct that. It's 85% of people who have detectable disease. There's actually a larger proportion of people who get infected but don't actually show symptoms. So among those that show symptoms, about 85% will have mild to moderate disease. About 15% will have disease that they need supplemental oxygen for, or some other sort of medical attention. And it's around, I believe, about 3% that have more severe disease requiring intensive care.
Let me go to, this is for Dr. Katchka. What's the latest on testing, particularly here in South Carolina? We've heard reports of testing capacity being limited. and what are some of the reasons that that's happening, if it is, and how much longer should we expect this to be the case?
We've previously had some limitations. Our DHEC Public Health Lab has had trouble in the past obtaining some of the chemical reagents that are needed to do the testing, and that has resulted in some backlogs previously. We get those through the CDC, and actually currently we are getting enough to do testing. We're actually operating at below capacity and are kind of putting out the message that those who are able to should do more testing on symptomatic individuals. We had provided some guidance to healthcare providers previously on who they should prioritize for testing back when testing was more limited. We are asking them to expand testing more to help us identify some of these cases. Unfortunately, it's not just the lab capacity that is an issue. There is a shortage of testing supplies out in the community and a shortage of the protective equipment that the healthcare provider needs to wear when they're collecting the specimen. So that's another issue that we're working on addressing, but some of these supplies are limited right now.
Okay, thank you. Dr. Persino, could you explain what antibody testing is, along with how accurate the tests are and what role do they play?
Yeah. So this is an evolving science. Obviously, after a person has had exposure to the virus, antibodies play a major role in trying to clear the infection. And traditionally, many of the diseases are diagnosed by checking the antibodies. Some antibodies are curative or protective. Some antibodies are not. For example, in case of HIV or hepatitis C, they have antibodies in their bloodstream, but they have the infection. They have a high number of amount of viral particles in their blood, but their antibody is positive. So in those circumstances, the antibody is not protective. What we are hoping, and what the research is beginning to possibly point in that direction, is that the antibodies against COVID have show promise in having some degree of protection against reinfection and actually curative rate. And so some of these tests that are being developed and have been developed, they look at the level of antibody in a person's blood, and that is an indicator, is an indirect indicator that a person has had infection probably in the recent past and has recovered. Now, how long that antibody actually lasts, when does it actually develop in the course of the disease, and how effective it is in protecting you from future infections, that is yet to be seen.
Any of the other doctors want to comment? Okay. Dr. Shaw, what about saliva testing or blood testing? Is there any such thing for COVID-19, and is it effective?
As we just discussed, so antibody testing, a lot of that involves blood and getting a blood sample, whether that is a venopuncture or, you think of a red top or a purple top tube or even a finger stick. And we're looking at alternate ways of, performing diagnostic testing for COVID-19. We continue to receive a number of applications, for diagnostic tests, and test developers are looking at, different ways to test. Most of the tests that you currently see on the market are either a swab from the nasopharynx or from the throat. We recently issued an emergency use authorization for a saliva-based test to a university in New Jersey. And we continue to, look at the performance characteristics of these tests as we, issue authorizations for them to go to patients.
Okay, let's dig into the testing a little bit more. Is there anything that, as an example, if you're not feeling well, when should you call your healthcare provider? When should you get a test? Has anything changed on the guidance there?
I would say that if you're not feeling well, we would recommend talking to your healthcare provider and kind of discussing what symptoms you're experiencing. They can kind of help work through if testing is appropriate for you. As I mentioned earlier, there are some limitations in testing right now. Not all providers may have the necessary materials to do the testing. We're trying to get that out to the community, but I do say that any time that you're not feeling well, you should discuss it with your healthcare provider, and we're providing some guidance to them on when to do the testing.
Okay, let me comment on testing that the hospitals are doing. I had a chance to talk to the CEO of Piedmont, Mark Nasaka, and he was saying that anybody that comes into the hospital, they do a test. And if you're running a fever, if anything that they suspect, you go in a completely separate unit than where if you're going in for surgery. A lot of people are hesitant about going in. Now actually is a great time if you've got surgery that has been scheduled to call your physician and call the hospital, get on the schedule, because they're taking extra precautions to make sure that you're not put with other patients that may or may not have the coronavirus but sick in any way. So it's a safe time now. They have beds available. And the good news is that I think all over the country the projections have not matched up as far as what they were expecting from the deaths and from the people who are getting it. So now's the time to, again, if you've been hesitant about going into the hospital, none of the physicians here in York County have been infected with the coronavirus. So take that to heart as you go forward. And I guess this is for anyone. Will my health care provider tell me where to go to get tested? And then as a follow-up, how can I find out where to get tested? Dr. Persina?
Yeah, so a couple of things. I just, before you decide to be tested, I wanted to review some of the signs and symptoms of people that we are seeing with COVID. And if you have these symptoms, I definitely would encourage you to discuss with your healthcare provider and get tested. We now understand that COVID is not just purely a respiratory symptom, but usually a great majority of the patients with COVID do have some cough, some degree of shortness of breath, sore throat, body ache, GI symptoms, nausea, even vomiting at times, diarrhea, abdominal pain. If you have the constellation of these symptoms and you have fever, you definitely do need to be tested for COVID. If you want to be tested just because you're curious or just because somebody's cousin's brother's neighbor got exposed to COVID, I would caution you because, even though eventually we would like testing to be available to the general public as such that everybody should get tested, but right now because of the tremendous demand and pressure on the healthcare system, we do have shortage of the personal protective gear that we need to wear when we are testing you, and that needs to be discarded later. We do have shortage of some testing kits, and it might add extra burden on the system if you do not have any symptoms and go and try and get tested. There are available locations in the county. I know there are facilities that actually even have drive-through testing. And you need to make an appointment, and upon the recommendation of your doctor, you can go and get tested. As Congressman mentioned earlier, obviously we do test at the hospital quite often in the emergency room, and our turnaround time for testing is actually very, very good, very, very good now. And a lot of the patients, anybody who does come in with any of the symptoms that I mentioned earlier, will be isolated immediately. They'll be tested, and they will not be in any close proximity of other patients unless their test is negative.
Thank you. Dr. Shaw, could you explain the difference between vaccines and therapies, and what's the latest on the possible therapies for COVID-19?
Congressman, just very broadly, the difference between a vaccine, which is more prophylactic, we generally think of a vaccine as given to a patient before they develop COVID-19 versus a treatment which would be used once a patient either has known or suspected COVID-19. We're working very hard on bringing both a vaccine and treatments to the market and be made available to patients. On the treatment side, we're looking both at existing treatments, existing drugs, and therapies that are available on the market where we may find some effectiveness against COVID-19, and so we're encouraging the development of clinical trials whereby we can put these treatments to the test, so to speak. We want to make sure that we collect high-quality, rigorous data from patients so that the agency can make some determinations about whether a treatment is effective or not effective. We're also, we're mindful that right now, during this pandemic, in the absence of a treatment, we really encourage, patients to work with their doctors to understand, especially for treatments that we hear about that are on the market and may be effective against COVID-19, really for patients to have that discussion between their doctor. We're encouraging folks to, look for clinical trials that their doctors may be able to point them to. And we're working as an agency with a number of pharmaceutical companies and other developers to hopefully bring a treatment to market soon. On the vaccine side, similar to treatments, we don't have a vaccine available, but we have a number of vaccine candidates that are going into clinical trials, and we hope, with the full weight of the, it's really an all-of-government approach here to working with academia and working with industry to hopefully get a vaccine to market soon.
Okay, thank you. This question's for Dr. Ketchka. It's from Lindsay on Facebook. If we aren't testing mild cases, how do we know how many cases we actually have?
That's a very good question, because we do know that there are many cases out there that we're not capturing right now with the limitations that we have in the testing. We have worked with different statisticians at university level, along with those in DHEC, to kind of get an estimate of the true number of cases out there. That includes those that we haven't been able to identify, and potentially includes those who may have been infected and are currently not showing any symptoms. And I'm looking for our projected numbers right now. If you come back to me later, I can provide that number of what we've projected as the true number of cases.
Okay. This is for Dr. Persina, but really any other doctors that want to chime in. Is COVID-19 mutating?
Yeah. So we know something about RNA viruses as a whole. We do have a lot of different RNA viruses in nature, and influenza, the famous influenza, is an RNA virus, and the reason you need to have a vaccine every year is because of the antigenic drift that we do see in the virus. There is this minor mutations that kind of helps it escape your immune response. Now, is that true in case of COVID-19? We do not know, but there is some amount of change and mutation that is expected. And as and when hopefully we do have a vaccine against it, and as this virus keeps coming back, there is a possibility that you may require yearly vaccination after that because of the changes that happens to the virus beyond. These are questions that we don't know yet, but we are really working very, very hard on the subject. But as a whole, I expect any RNA virus to have some degree of mutation because of the way they replicate inside the human cell. The entire mechanism is kind of faulty in its replication. So there'll be some minor changes. It's like making photocopies of the original. The photocopies are never exactly like the original as it replicates. So, but I do not expect major mutations that would make it completely a brand new virus.
Thank you. Dr. Persina, this is a question I get a lot. What are some of the long-term health ramifications for those who are recovered for COVID-19? Is it lung damage? Is there any other problem that they either need to be aware of or treated for?
Yeah. So based on our limited experience with what we have been going through over the past few months, I believe it depends on the degree of the severity of the infection, the original infection. We have had patients, as you know, a great majority of the people who catch the virus, they recover completely without any problems, and quite often they are completely asymptomatic to begin with. But among those who end up with severe disease in the hospitals, in respiratory distress, requiring intubation, mechanical ventilation, lengthy hospital stays and ICU stays, we do see consequences after. Quite a few of them do end up with even strokes, with cardiac issues, permanent lung damages and scarrings, kidney failures requiring temporary or even permanent dialysis. And those are some of the things that we probably will be understanding more as we go along, why they happened. But the virus tends to attack a lot of vital organs. And so, yes, we do see a lot of consequences after the infection.
To our listeners, this is Congressman Ralph Norman. We're going over the latest with the COVID-19. We have 15 minutes left. We go to the top of the hour. Again, I want to thank WRHI and Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Camborium Cable, which is being carried in York and Lancaster counties. As we talk about getting back open, which is the top priority now, the businesses are going to have to open up. People have to make a living. From a professional medical standpoint, once that happens, and we're gradually doing it in South Carolina with retail and the beaches opening up, what needs to happen, or what does that person need to, in his mind, be aware of when he goes back into the public, when he goes back to work, and when he deals with other people? Unless I'd like a comment from each one of the doctors. Dr. Shaw, let's start off with you.
Congressman, what I'll say is that we've been working very closely at the FDA with the White House and with the White House Task Force, to have a very clear plan, working jointly together, with the state governors, including Governor McMaster, to have a very clear plan and defined thresholds, as we reopen the economy. It's not like a light switch. It's very much like a sunrise. And we want to do so in a way that, that allows the public to maintain safety precautions, such as being able to keep certain social distancing measures, certain measures in place around face coverings and respirators and masks. But we want to work together with the states. And the United States, it's a big country, and there are different population densities. There's different considerations in different localities and municipalities, and we want to be mindful of those. And so this is truly a public, partnership between the federal government with the states, with the cities, and with Congress to ensure that we have a tailored approach on a state-by-state level for reopening the economy.
Dr. Persina?
I completely agree with Dr. Shah's assessment. I believe that obviously, we need to get back to work. We need to get the people's lives has been on a pause for several weeks now. Public messaging and communication, education, and understanding that this virus is extremely contagious. And that awareness will provide a degree of protection, I believe. I am so proud of my friends, my fellow citizens across the country. Everywhere I go, everybody is observing social distancing. And sometimes I have to catch myself because I deal with this every day of my life these days, all day, with COVID patients, and after a while you kind of get desensitized and you forget. And then I go to the store, and the first thing they ask is, have you been in contact with somebody with COVID? And I just don't know what to tell them. But I think the awareness has really played a role, and as we open up the state and the country, the more people know and the more they do their social distancing. And I would encourage everybody to continue wearing their masks, to continue strict hand hygiene, even if there are no more social distancing rules and there are no more stay-at-home orders. If it makes it even more important for you to observe those. And if you are sick, if you develop any symptoms, please stay home. This virus is extremely, multiple times more contagious than the flu. And as we always used to advise people to stay home when they have the flu, don't go to school, don't go to work. This makes it even 10 times more important.
Dr. Kachka?
Yes, thank you. So I agree. Something people need to keep in mind is that reopening doesn't mean immediately jumping back into everyday life as we used to know it. These kind of social distancing precautions are going to be with us for the foreseeable future. We will look at ways to safely reopen the economy to make sure that people can get back to work and that people can go about their lives. But people will need to continue to observe the social distancing rules. The numbers that I was looking for earlier, so we've identified about 4,917 cases in the state thus far. Our projections are that there may be as many as 30,000 cases in the state. So essentially that means our model suggests we've only identified about 15% of the cases. So among those, about 25,000 other cases, some of them will never show symptoms and not know that they're contagious. Some of them have not shown symptoms yet, so they're not showing symptoms, but they may be contagious already, and that's the really important reason that we need to continue the social distancing. So, as we look to reopening, we'll be advising businesses how they can safely do that, so that people can continue to observe the social distancing within those settings, and then also people need to take the responsibility to make sure that they're doing it themselves to protect themselves and to protect others.
Okay, and from what, and Dr. Kachka, if you could lead off on this, but from what we know now, what does this mean for summer camps, sporting events, amusement parks, and really churches? From where your vantage point, where do you think, from a timing standpoint, we would be safe to gather as we normally have, using the precautions that you just cited?
So it's hard to estimate a time frame. We'll look to be doing the reopening and have new rules in place that allow it to be done safely. Like I said, we'll have to make sure that the businesses are able to allow people to observe that social distancing. So when we talk about sporting events and churches and that sort of thing, sporting events in particular, they may be stuck with selling a lot fewer tickets and making sure that they can allow the people watching to spread out a little bit more. So things are going to look a little bit different, but there will be ways that we can probably safely reopen different events like that going forward.
And this is for any of the doctors. Again, knowing what you know now, what does life look like for America and for South Carolinians 3, 6, 12 months from now? From where you sit, and Dr. Persini, you can lead off on this.
Yeah, so we a couple of years ago we had a very heavy season for influenza, and it was horrible, and it reminded me of the really, really bad flu seasons of decades ago, and everybody expected things to really be bad beyond then. But then again, we bounce back and things improve and people develop immunity. And I think coronavirus very soon, the way our projections have been always a lot worse than what happened in reality. And that is the result of the extraordinary efforts of people and the healthcare system in the country. And I believe that we are going to be okay. I believe that in a few months, this is going to be part of the reality of life, but at the same time, we are going to be a lot better off than now. And as time goes by, it's going to become more and more of a bad memory.
Dr. Kachka?
Yeah, so I agree with that. Things are going to look things are going to look different over the next few months, but progressively things are going to start to get a little more back to normal. Like I said, with the reopening plan, we may have businesses that have people lining up outside to get inside because of, needing to reduce the maximum capacity in the business to allow the social distancing. We may have sporting events where people are spread out in the seats in the rows to allow for the social distancing. Over time, as we see the reduction in cases, we'll be able to kind of relax that social distancing. So I would say over the next few months, it's going to look very different, but progressively moving to more normal life as we know it.
Dr. Shaw?
Congressman, from the FDA's perspective, what I will say is that this experience, and as we've seen a number of cases, increase over time and kind of throughout the country, and as we hopefully see this curve begin to flatten even further, we'll learn from this experience. Hopefully this will bring to light a vaccine, a treatment. We've learned, and even the general public has learned about the importance of hand washing, donating blood, and together we will learn from this experience.
Okay, well, we've got 4 minutes left. Let me ask, I want to thank again all of our panelists for your expertise and for taking the time to do this. Let me, if I could, each one of you, starting with Dr. Persina, just give us a brief closing remarks that you would want the listeners to know.
Thank you, Congressman. It's been my pleasure to be able to be involved in this and to help disseminate information. Coronavirus, as everybody knows, is an evolving science. Every day we learn something new, and we are answering a lot of questions that we have had. Survival from this virus is significantly improving. We have done great compared to other countries in the world. Our survival rate is significantly better than almost any country you can name, and there is a lot of hope. And I would continue your social distancing, hand hygiene, as my colleagues mentioned, wearing your face mask, and try as much as possible not to gather in groups, even though the restrictions are going to be relaxed. Try as much as possible to prevent the spread of the disease. And I think we are by next year, this time, we are going to be looking at this just as a historical fact.
Great. We've got 1 minute left. Dr. Shah?
Congressman, thanks again for hosting me and the FDA on today's town hall. I will say that please follow the recommendations by state and local authorities with respect to social distancing and safety precautions to be taken in public. This is one of the best ways for us together to flatten the curve. As my fellow panelists have mentioned, these are extraordinary and unprecedented times. Continue to check in on your loved ones. And lastly, donate blood. That's the best way to help your fellow Americans.
Dr. Ketchka. Thank you, Dr. Ketchka.
Thanks. I know we're short on time, so I'll just thank all the citizens of South Carolina for everything that they're doing. I know that this has been a very difficult time, and we appreciate everything they've done to help flatten the curve and continue to look out for our recommendations to make sure we can safely reopen.
Well, I just want to thank our listeners. This has been a great hour. I hope you have learned something new about the virus and how to deal with it. As the panelists have said, that we're going to get through this. This is different. We've never had this before, and it's something that is going to be with us. The new normal in our country is taking the precautions that our panelists have mentioned. A lot of it is common sense. And the difference here with the COVID-19, you're not just affecting yourself. You're affecting your family. You're affecting your coworkers. If you choose to ignore the symptoms, then you're affecting everybody that you love and care for. Again, call our office. Kathy Rose, do you have any closing?
Just phone numbers.
Okay. Call us at 803-327-1114. You can follow me at repralphnorman.com. And again, the money is going to be short, even the new funding. However, go ahead and apply if you have not already. If you have applied, if you run into any difficulty, touch base with your banker and find out a step-by-step process of what's going to happen. It's a pleasure to serve the 5th District in South Carolina. Thank each one of you for taking your time to join us today, and God bless you.
South Carolina's most honored radio station, News Talk 100.1 WRHI Rock Hill, W261CY Rock Hill, the voice of York County.
An OTS media station.
Fox News. I'm Lillian Wu.
One of President Trump's thoughts on coronavirus has some medical professionals and a disinfectant manufacturer warning people, don't try this at home.
President Trump, during his daily briefing,